you do? Chase the wheel, pick up some loads and bring it over. Yeah. Alright, take Bob.
Yep, good.
You okay? I'm alright, but I think the fire.
Okay, there you go. Thank you. Accidents happen, and it's human nature to want to help when someone's hurt. But did it occur to you that our forklift operator, let's call him Bob, might actually be in danger if he aids his injured coworker? That's right. There's a potential for harm here that's too small to be seen by the naked eye, but it could change Bob's life forever. Bob could be exposing himself to bloodborne pathogens. Bloodborne pathogens are bacteria and viruses that live in blood and other body fluids. You can't see them, but they can cause devastating diseases like hepatitis B, hepatitis C, and HIV. Diseases that can make you very sick, or worse. Tens of thousands of new hepatitis B, hepatitis C, and HIV cases are reported every year, and a significant number of them happen after an exposure incident in the workplace. It's frightening but true. Anytime or anywhere you come in contact with someone else's blood or body fluids, you're at risk of a potential exposure.
Bloodborne pathogens can have long-term serious health effects for anyone.
It's important to protect ourselves against pathogens in the workplace because many of the diseases can cause serious consequences with our health. Example, you can have liver damage that can lead to eventually death.
We need to be concerned because there's diseases that one employee can give to another employee, and that's a huge liability for a company or an employee's health.
To make matters worse, if you're infected with a bloodborne pathogen, you're the one whose blood and body fluids other people have to worry about. And that puts your family, your friends, and your entire quality of life in jeopardy. Bob is especially concerned here because he caused the accident that hurt his coworker. Let's call her Cindy. His first instinct, and rightfully so, is to help her. But if Bob has any open sores on his hands, even something as small as a hangnail or a paper cut, and if Cindy's a bloodborne pathogen carrier, he could get the infection too. The Occupational Safety and Health Administration, or OSHA, calls body fluids that aren't blood other potentially infectious materials, or OPIM. OPIM includes the body fluids we've come to associate with bloodborne pathogens, like semen and vaginal fluids. But contrary to what some people think, sexual intercourse isn't the only way you can be exposed to body fluids that may be contaminated with bloodborne pathogens. Saliva, sweat, or vomit that's visibly contaminated with blood are also considered potentially infectious. And if these body fluids are indeed contaminated and they contact your eyes, mouth, or nose, or an open wound of any kind, they can enter your bloodstream. There's no telling what kind of havoc they might wreak once they get there.
Just because you know somebody doesn't mean you know if they carry a disease that you could catch through bloodborne pathogens.
They can be carrying the silent killer in their blood, so it's important to protect, even if you know the person for a long time.
You can never tell for sure when looking at a person if they have a specific disease. A lot of diseases can lay dormant, and until the person becomes actually in an infectious stage in their life, you don't know if they're a carrier or not.
You simply can't predict whether people carry a bloodborne pathogen by the way they look or behave. Anyone can be a carrier and you wouldn't know it. They might not even know it. That's why you should treat every situation as though the person's a bloodborne pathogen carrier, no matter how well you know him or her, no matter how remotely they fit the idea you have of someone who may be infected. So who should protect themselves against bloodborne pathogens? In a word, everybody. Unfortunately, workplace accidents can happen at any time without warning. And most people will automatically want to aid the person who's hurt. Many companies are required by OSHA to have trained first responders on site to help injured employees, along with medical supplies to treat the wounds. These are companies that are likely to have accidents that could result in severe injuries, or businesses that can't expect to get emergency care in a reasonable time frame. OSHA also requires any person at your company who may come into contact with blood or OPIM as part of their job duties to be trained on bloodborne pathogens exposures at the beginning of their assignment and get refresher training once a year after that. Employers are required to offer these individuals the Hepatitis B vaccine series and also to have an exposure control plan that outlines the steps to take when blood or OPIM are likely to be present. The thing is, you may not be someone whose job actually involves contact with blood or body fluids, like these workers. You may think you have no reason to worry, but even in the safest of settings, employees can get hurt.
Some of the common situations that might arise might be due to coming upon a person that's bleeding in your workforce, or you might have an unsuspected needle in a trash in a bathroom for somebody that's diabetic and you didn't know that was there, and when you put your trash in it, you may become exposed. So anytime you come in contact with an unknown source, you are at potential risk for contacting an infectious disease.
So no matter what your job is, you need to be aware of how hazardous bloodborne pathogens are and know how to protect yourself. Whether you work in a plant, an office, a lab, anywhere you encounter other people. Let's rewind and look at what Bob should have done before helping Cindy.
Cindy, you alright?
I'm alright. My arm really hurt.
Hold on, I'll go get help.
Thanks, Bob.
Joanne, we have an injury on the floor. Can you call for help?
911, Department 10, First Aid Responders. 911, Department 10, First Aid Responders.
In this revised scenario, we see the first thing Bob does is call for help. Just like when you learn in CPR training to call 911 before you attempt to resuscitate a victim, your first step in helping an injured coworker should be to call your company's emergency contact number. You might think you don't have time to contact anyone before you act, but if your company has designated first responders, they're the ones with the training and equipment to help. And if the incident is serious, you want them there as fast as possible. So be sure you know where phones are located and what number to call in the event of an emergency. Whether you're a designated first responder or not, you need to protect yourself. Precautions only take an extra moment, and they can save a lot of anxiety and anguish down the road. There are several safety measures called universal precautions that every first responder should take. We'll cover them in detail in a moment, but first, here's a quick overview. For those of you who might be exposed to bloodborne pathogens as part of your job, make sure you get proper training. And no matter what your job is, treat all blood and OPIM as though it's contaminated. Always use personal protective equipment or PPE that's appropriate for the situation. Learn and heed special labels and signs. Learn and follow protective work practices. And take advantage of the Hepatitis B vaccine if it's offered to you. Now, let's look more closely at each of these precautions. If you're exposed to bloodborne pathogens as part of your job, your employer is required by OSHA to provide you with training. That includes first responders, naturally, but it also includes people like on-site nurses and custodians who might have to clean up after an injury, or who may be exposed to needles, blood, or body fluids during a normal workday.
Employers should train every employee on bloodborne pathogens. Everyone could potentially be at risk.
I believe that it's important for other employees to be aware of the dangers, because I would believe that if there was an injury on the floor that most bystanders would try to help somewhat, and if they're unaware that they could be contaminated, they could find themselves going in for shots.
As for whose blood or body fluids you should worry about, don't even try to guess. Anybody could be a carrier, and you don't want to find out about it after you've been exposed. All employers, including yours, are required to make proper PPE readily accessible to you and your coworkers where exposure risks occur. Know where gloves, face masks, goggles, and gowns are stored. And know how to properly wear them. That includes making sure gowns are tied in back to prevent strings from dangling in contaminated materials. Disposable gloves are the most commonly used protective item, for obvious reasons. Your hands are the most likely part of your body to come in contact with another person's blood or body fluids. Some people are allergic to traditional latex gloves, so your employer must provide hypoallergenic or powderless gloves as an option. Before you put gloves on, check to make sure they're 100% intact. They can break down if exposed to temperature extremes, and then they won't help anybody. Be sure to remove disposable gloves as soon as possible after they're contaminated, or if they become torn or punctured. And when you do, use caution. Peel off the first glove and hold it in your still gloved hand. Then, with your uncovered fingers, peel off the remaining glove from the inside, being careful not to touch the glove's exterior. Always wash your hands immediately after removing gloves, or use antiseptic cleansers and wash at the first opportunity. The same caution should be taken when removing other protective gear, which may require you to put on a fresh pair of gloves to finish the job. Discard gloves and other protective gear in properly labeled biohazard bags or receptacles. Never reuse them. Just as important as wearing protective gear is to learn and heed special labels and signs. You're probably familiar with the universal biohazard symbol. When you see it, take it seriously. If an area or item is marked with this symbol, it means that blood or other potentially infectious materials, OPIM, are present. For example, if blood is splattered to areas that can't be cleaned without special expertise, like inside a machine, your employer is required to mark the area with a biohazard label until cleaning and disinfecting can be completed. If you're the person who has to service a machine that's been contaminated with blood, you need to know about it before you begin the job. Keep in mind, the hepatitis B virus can live up to 7 days in dried blood. So wherever you encounter the biohazard symbol, make sure you take the proper precautions to protect yourself. Also critical, follow protective work practices designed to eliminate the possibility of cuts or punctures in the first place. Here are some common examples. Never pick up broken glass, metal shavings, or other sharps by hand. Use a broom and dustpan instead. Don't bend or break used blades. Don't recap needles. Dispose of used blades or sharp items in puncture-resistant containers. And dispose of large, sharp objects in barrels or other strong receptacles. And always wear heavy-duty gloves when you do.
Protective work practices are important because not only does it keep you from having a scene to clean up with blood spills and injuries, but the employee being injured, it saves you from having to get stitches and doctors and, of course, infections on their part. So wearing gloves around sharp areas is important. Wearing long pants where necessary is important. And even long sleeves can help keep you from getting a cut.
There are also protective work practices that minimize the chance of spreading infection and exposing others. For instance, avoid eating, drinking, applying cosmetics, or handling contact lenses in areas where biohazard materials are used, stored, or present in any way. Don't store food or beverages in these areas either. The point is, you have to keep your distance from biohazard materials whenever practical. The last precautionary measure you need to know about is the Hepatitis B vaccine. As many as 1 in 20 individuals is infected with the Hepatitis B virus at some point in their lives. So of the diseases discussed so far, this one is the most prevalent. Think about it. If your company has 500 employees, chances are at least 25 of them have been or will be infected with the Hepatitis B virus. And you have no idea which 25. The bad news about Hepatitis B: it can be lethal if it's not treated. The good news is you can get vaccinated against it, whereas there's no such vaccine for Hepatitis C or HIV. Employers are required to offer the Hepatitis B vaccine to all employees whose jobs expose them to blood or OPIM, and it has to be offered within the first 10 days of the assignment. That doesn't mean these employees have to get the vaccine. They can choose not to and sign a form saying they declined it. If the at-risk employee who declined the vaccine is exposed down the line, though, the employer must offer the vaccine to him or her again. Your employer isn't required to offer the Hepatitis B vaccine to workers who perform Good Samaritan acts. In other words, if you help someone but it isn't part of your job duties and you have an exposure, your employer doesn't have to offer you the vaccine. The vaccine should be offered, though, because OSHA strongly recommends that all exposed employees be vaccinated within 24 hours of the incident. That's when the vaccine is most effective. If your employer doesn't offer the vaccine, seek it on your own from your doctor or local clinic. No vaccine is foolproof, but the Hepatitis B vaccine will dramatically improve your chances of avoiding a potentially deadly disease. So why would you not protect yourself? Remember, there's no vaccine available for HIV, Hepatitis C, and other diseases caused by bloodborne pathogens. So wearing protective gear and following safe work practices is still absolutely critical, even when you've been vaccinated. An exposure occurs when you come into contact with blood, other body fluids, or tissue that enters your system through the eyes, mouth, nasal membrane, non-intact skin, or pierced skin. What should you do if this happens to you? OSHA recommends taking these steps. 1. Immediately flood the exposed area with water. 2. Clean any wound with soap and water or a skin disinfectant if available. 3. Report the incident to your supervisor. And 4. Seek immediate medical attention.
It's important to act immediately after a potential exposure to minimize your risk of developing a full-blown disease.
There are some bloodborne pathogens that would require immediate treatment or preventative measures, so it's important to get it documented and to be able to begin the proper treatment as soon as possible. It's also very important to start to create that documentation trail. Even if nothing happens to you immediately, you could have serious health effects down the line.
If your clothing is exposed to spatter from someone else's blood or body fluid, remove the item at work and immediately dispose of it in a biohazard receptacle. Do not attempt to clean contaminated clothing in any area where other people might get exposed, such as the employee restroom. And do not take it home to wash it, or you put your family at risk. Your company's exposure control plan contains the names of people to contact and methods of reporting an exposure, which will be shared with you as part of your bloodborne pathogens training. If an exposure occurs, access this plan and follow the steps outlined. It's critical to report an exposure immediately because you need to get the hepatitis B vaccine within 24 hours for it to be most effective. Another key reason to report it: it could take months or even years for a disease to develop. And if a disease does develop, both you and your employer will want to make sure there's a record of how and when the exposure occurred.
Hold up. What? I've got to do some cleanup here.
After an accident, people may enter a potentially contaminated area without realizing the dangers it poses. But as long as there's blood or OPIM present, or if the blood or OPIM has been removed but the area hasn't been disinfected, bloodborne pathogens could still be present.
One example is HIV, and that is a bloodborne pathogen that needs to be transmitted via fluids. So once it is exposed to air, it usually will die within a few minutes. There are other bloodborne pathogens, however, that can live up to 7 days.
That's why only a person trained in bloodborne pathogens hazards should be allowed into the area, and it should be decontaminated as soon as possible. Your employer's exposure control plan outlines the decontamination method you should use. But here's a typical sequence. First, prepare for cleanup the same way you would prepare for helping an injured person. Put on gloves, and as needed, a face mask, goggles, and maybe a gown. Tape off the area so other employees know to avoid it. Don't mop up blood or attempt to wipe it up. You'll risk splashing and spreading it around. Instead, use an absorbent. Then collect the material with a broom and dustpan and deposit it in a designated biohazard bag or receptacle. Once the blood is removed, decontaminate the area using a disinfectant capable of destroying bloodborne pathogens, either an EPA-approved disinfectant or a fresh mix of 1 part household bleach to 10 parts water. Disinfect items that have been exposed to blood or body fluids in a sink dedicated to industrial use. Never use a break room or bathroom sink. Finally, clean and disinfect the sink and properly remove and dispose of your protective gear. The cleanup crew is finishing up at the scene where Bob and Cindy's accident occurred. But what's wrong with this picture? Our cleanup person threw his gloves in a regular trash bin. That's an unsafe way to dispose of biohazard materials. He's putting other people who may use or empty that trash bin at risk. Dealing correctly with bloodborne pathogens doesn't just mean protecting yourself. It also means protecting the next person from exposure. Any areas that couldn't be cleaned right away, like cardboard boxes that could contain microscopic droplets of blood, or areas inside a machine, need to be appropriately labeled. Dispose of any sharp objects that have been contaminated with blood or OPIM, like needles, glass, or blades, in appropriate sharps containers. If the sharp object hasn't been exposed to blood or body fluids, it should be wrapped up and disposed of in a way that prevents someone else from being injured. Also remember to properly dispose of the protective gear you're wearing. Don't just throw it in the trash. Use appropriate biohazard bags or receptacles. Let's check up on Bob. Because he was exposed to Cindy's blood, his employer, like all employers in this type of situation, must provide an immediate, confidential medical evaluation to determine Bob's level of risk. That's true for other employees who were exposed during the incident as well, including the injured person, first responders, and cleanup personnel. The medical evaluation has to document how the exposure occurred and include the identity and test results of the person whose blood was contacted, if feasible. If the exposed person consents, his or her blood will be tested, and if needed, counseling can be provided. If you're an employee, like Bob, who's been exposed to blood or OPIM, your employer must keep your medical records for the duration of your employment, plus 30 years. Why should you care? Because if you develop a bloodborne disease years later, you can go back and check your employment records for documentation of the exposure. You have a right to examine your medical records at any time, but they can only be released to other parties with your consent, or if required by law.
The employee would find in the bloodborne pathogen exposure file a medical evaluation form signed off by the physician, also find the lab test results with the results given to the patient signed off, and also the incident report form describing the incident and how the exposure happened. All these reports are kept confidential.
Hey, Bob! Hey, thanks for all your help today.
Hey, no problem. Good.
At least it's not my good arm. Still shooting darts tonight.
Good. See you tonight.
It's an unfortunate fact that exposure to bloodborne pathogens can happen to anyone, at any time. But there's no need to turn an accident into a life sentence of worry and illness. Protect yourself. Protect your coworkers. And protect your family, friends, and your quality of life. Know and follow the precautions every person should take when there's a potential for exposure to bloodborne pathogens. Treat all blood and OPIM as if it's contaminated. Use proper personal protective gear. Learn and heed special labels and signs. Follow protective work practices. Take advantage of the Hepatitis B vaccine. And follow appropriate cleanup, disposal, and labeling procedures. For most of us, our first instinct will always be to help someone who's hurt. It's human nature. But we should be smart about it. The key is, when there's a potential for exposure to bloodborne pathogens in the workplace, prepare before you act. Your life, and the lives of those closest to you, may depend on it. It's an unfortunate fact that exposure to bloodborne pathogens can happen to anyone at any time. Everyone should know how to protect themselves against this potential danger and what to do if an exposure in the workplace occurs. Bloodborne pathogens are bacteria and viruses that live in blood and other body fluids. These fluids are called other potentially infectious materials, or OPIM, and include semen, vaginal fluids, and saliva, plus sweat, tears, or vomit that's visibly contaminated with blood. You can't see bloodborne pathogens, but they can cause devastating diseases like hepatitis B, hepatitis C, and HIV. If you encounter blood or body fluids contaminated with bloodborne pathogens, and these fluids come in contact with your eyes, mouth, or nose, or an open wound of any kind, you can become infected. There are several safety measures called universal precautions to take if you encounter blood or other body fluids. For those of you who might be exposed to bloodborne pathogens as part of your job, make sure you get proper training. And no matter what your job is, treat all blood and OPIM as though it's contaminated. Always use personal protective equipment or PPE that's appropriate for the situation. PPE includes gloves, masks, goggles, and gowns. It's essential to learn and heed special labels and signs like this universal biohazard symbol. Also critical, follow protective work practices designed to eliminate the possibility of cuts or punctures in the first place. Never pick up broken glass, metal shavings, or other sharps by hand. Use a broom and dustpan instead. Don't bend or break used blades. Don't recap needles. Dispose of used blades or sharp items in puncture-resistant containers. Dispose of large, sharp objects in barrels or other strong receptacles, and always wear heavy-duty gloves when you do. In addition, follow protective work practices that minimize the chance of spreading infection and exposing others. If biohazard materials are used, stored, or present in any way, don't eat, drink, apply cosmetics, or handle contact lenses in the area. Don't store food or beverages there either. Get the hepatitis B vaccine if it's offered to you. This vaccine is most effective before an exposure or within 24 hours afterward. If you have an exposure incident, follow these steps. 1. Immediately flood the exposed area with water. 2. Clean any wound with soap and water or a skin disinfectant if available. 3. Report the incident to your supervisor. And 4. Seek immediate medical attention. Remove contaminated clothing at work and immediately dispose of it in a biohazard receptacle. When cleaning up contaminated areas, use caution. Wear protective clothing. Tape off the area so other employees know to avoid it. Don't mop up blood or attempt to wipe it up. Instead, use an absorbent. Decontaminate the area using a disinfectant capable of destroying bloodborne pathogens. And disinfect items that have been exposed to blood or body fluids. Also, protect the next person. Appropriately label areas that couldn't be cleaned and disinfected immediately. And wrap and dispose of sharp objects in a way that prevents someone else from being injured. The key is, when there's a potential for exposure to bloodborne pathogens in the workplace, prepare before you act. Your life and the lives of those closest to you may depend on it.
Bloodborne pathogens can have long-term serious health effects for anyone.
It's important to protect ourselves against pathogens in the workplace because many of the diseases can cause serious consequences with our health. Example, you can have liver damage that can lead to eventually death.
We need to be concerned because there's diseases that one employee can give to another employee, and that's a huge liability for a company or an employee's health.
Well, bloodborne pathogen exposure can be very dangerous, and of course HIV, there is really no known cure at this time.
Just because you know somebody doesn't mean you know if they carry a disease that you could catch through bloodborne pathogens.
They can be carrying the silent killer in their blood, so it's important to protect, even if you know the person for a long time.
You can never tell for sure when looking at a person if they have a specific disease. A lot of diseases can lay dormant, and until the person becomes actually in an infectious stage in their life, you don't know if they're a carrier or not.
Because of the nature, it only takes a speck of fluid to contaminate a healthy person.
You should always have a high concern for bloodborne pathogens. Anyone can have one, and you can't always tell just by looking at them.
Some of the common situations that might arise might be due to coming upon a person that's bleeding in your workforce, or you might have an unsuspected needle in a trash in a bathroom for somebody that's diabetic and you didn't know that was there, and when you put your trash in it, you may become exposed. So anytime you come in contact with an unknown source, you are at potential risk for contacting an infectious disease.
Employers should train every employee on bloodborne pathogens. Everyone could potentially be at risk.
I believe that it's important for other employees to be aware of the dangers, because I would believe that if there was an injury on the floor, that most bystanders would try to help somewhat, and if they're unaware that they could be contaminated, they could find themselves going in for shots.
Everyone should know bloodborne pathogens and exposure to bloodborne pathogens and be aware of the policies that your company would have in place.
Usually before putting on a pair of gloves, it's good to pull them out and just do a quick look, put them on, make sure that you don't see any punctures, any holes, any tears. If you do, immediately discard them and put on a new pair.
Gloves offer the first base line of defense for any exposure in case you would have a cut or skin abrasion on your hand. So basically they're just the first line barrier to any potential disease.
Rubber gloves give you the protection of keeping the fluids from entering any injury you would have on your hand. Another thing would be, if you did touch something without gloves, would be to put a disinfectant on it immediately and wash your hands.
Gloves definitely provide the most protection against bloodborne pathogens because they create a barrier.
Washing your hands is the best method that we know of today to protect ourselves from most bloodborne pathogens. It's the first thing that you should always do when you even think you've been exposed to bodily fluids or blood.
Hand washing is the most important thing you can do to protect yourself and others from bloodborne pathogens.
Anytime you administer any sort of first aid, or you are in an area that there's been an injury or an illness, you need to make sure you wash your hands thoroughly.
If your gloves are soiled, just remember anything you touch, you can then transmit that soiled material to whatever you're trying to take off. For instance, if you have a mask on and you go to take the mask off with the soiled gloves, you could then expose yourself to the body fluid. So sometimes it's good to take off the gloves, put on a fresh pair to remove the rest of your protective equipment.
Protective work practices are important because not only does it keep you from having a scene to clean up with blood spills and injuries, but the employee being injured, it saves you from having to get stitches and doctors and, of course, infections on their part. So wearing gloves around sharp areas is important. Wearing long pants where necessary is important. And even long sleeves can help keep you from getting a cut.
It's good to have good engineering work practices in force so that you minimize your chance of being exposed to any infectious diseases. It's important to act immediately after a potential exposure to minimize your risk of developing a full-blown disease.
There are some bloodborne pathogens that would require immediate treatment or preventative measures, so it's important to get it documented and to be able to begin the proper treatment as soon as possible. It's also very important to start to create that documentation trail. Even if nothing happens to you immediately, you could have serious health effects down the line.
It's important to act immediately after exposure so that you do minimize the risk by washing your hands. Even if you have gloves on, you should still disinfect.
One example is HIV, and that is a bloodborne pathogen that needs to be transmitted via fluids. So once it is exposed to air, it usually will die within a few minutes. There are other bloodborne pathogens, however, that can live up to 7 days.
It is important for an employee to have a medical evaluation after an exposure to not only provide documentation, but to also explain to the employee how important it is to come back for follow-up care if they have any acute symptoms or signs of illness during that time.
If you had to list the ways your employees could get hurt on the job, I bet you could come up with a dozen hazards without even trying. But would bloodborne pathogens be on that list? Unfortunately, most people don't think about bloodborne pathogens and the threat these dangerous microorganisms present. Bloodborne pathogens are bacteria and viruses that live in blood and other body fluids. They can cause devastating diseases like hepatitis B, hepatitis C, and HIV that can lead to serious illnesses or worse. Bloodborne pathogens infect millions of people, and tens of thousands of new cases are reported each year, many after exposure in the workplace. The thing is, you can't see bloodborne pathogens, and employees may not become ill for years after being exposed. Aside from the terrible uncertainty that creates for your employees' health and well-being, it leaves your company wide open in terms of risk and liability. But you can do something about it. Bloodborne Pathogens ExposureIn The Workplce is a program you can use to help employees minimize their risk of exposure. Designed to draw employees in from the very first scene, the video makes it easy to understand what bloodborne pathogens are, how to protect against them, and what to do if exposure occurs. A dramatic risk scenario involving a forklift operator and a warehouse employee is woven throughout the video to illustrate how an everyday situation can turn deadly. As the video progresses, employees see the scenario unfold and how the people involved are affected. This cradle-to-grave type of scenario helps put bloodborne pathogens exposures into context, so viewers understand the consequences of various actions they take or don't take. Short vignettes involving a variety of employees are used intermittently to illustrate the range of situations that can lead to bloodborne pathogens exposure. This unique educational approach makes the dangers of bloodborne pathogens personal to the viewer, so it's more meaningful and therefore more memorable. To make the training even more powerful, you can stop the video at critical points to discuss what participants would do if they were in a similar situation. Or you can ask for volunteers to role-play various what-if scenarios they might encounter. The discussion this generates can help employees pre-plan how they'll react if they're faced with a potential bloodborne pathogens exposure. You can also refer to your company's exposure control plan as you go through the video to highlight company-specific procedures your employees should follow. Practices illustrated in the video are consistent with OSHA regulatory standards, including 1910.1030, occupational exposure to bloodborne pathogens, and 1910.151, medical and first aid, to support and reinforce your overall objectives. Interviews with industry professionals are used throughout the video to convey valuable insights that drive home the precautions and techniques employees should use when there's a potential for exposure. Bloodborne Pathogens ExposureIn The Workplce can be used as part of your company's safety training or health and wellness training. It's an ideal component of a training program for employees whose job duties may expose them to bloodborne pathogens, And just as important, it gives all employees the information they need to protect themselves from this life-threatening danger. It's an unfortunate fact that bloodborne pathogens need to be on your list of workplace hazards. But with proper training, you can arm your employees with the information they need to protect themselves, as well as their coworkers, families, and friends.
As a manager, trainer, safety director, foreman, or supervisor, you're responsible for your employees' safety while they're on the job. You know the benefits of workplace safety go well beyond legal compliance. Fewer injuries on the job can mean lower health care costs, fewer worker comp claims, and higher employee morale. But what about employee safety off the job? Is what they do on their own time their business? Or should it, to some extent, be yours too? Most managers know that healthy employees tend to miss less work, have better attitudes, and be more productive. So even though you're not responsible for your employees' overall health and well-being, it just makes sense to encourage a safe, healthy lifestyle on and off the job. Back Safety, a User's Guide, promotes back health and safety as part of an employee's whole life health cycle, meaning it encourages employees to think about back health whether they're working, playing, or home with their families. With more and more people paying attention to their health every day, your employees should be very receptive to learning how to take better care of their backs. They should also appreciate that your company cares enough to want to improve their quality of health overall, not just in relation to their jobs. It's a good idea to tell employees that you're presenting educational information on back health for these very reasons. Back Safety, a User's Guide, can be used with equal success as part of your company's health initiative, safety program, or continuing education training. You may find it also makes a worthwhile standalone educational opportunity. It's knowledge that can lead to healthier, happier, more productive employees. Why wait? The sooner you share the information, the sooner your employees and your company can benefit.